Is it true that doctors will place bets to see what patients have before they check? So not really bets, okay? We don't bet. Fishy hands, what your earwax color says about your health, and heating up things to go to the bathroom? What? Today I'm breaking down and answering some of your most thought-provoking Discord medical questions. All right, let's dive right in. Why sometimes hands smell like fish if you haven't eaten any? That is a great question, and we do have different odors that could be from our bodies, from either different orifices through our skin, but when somebody describes this, it's something called fish odor syndrome. This is called trimethylamminuria. It's basically where the body is unable to break down trimethylamine, which is bacteria in our body can't break this down, and it has a pungent odor, so to speak. Sometimes it could be related to the foods that you're eating, could be genetic, where you have no choice in the matter, it's your genes, and you kind of have to figure out how to minimize the odor that you're producing. Then, like, what do? Okay, first, go see your doctor, see your healthcare provider, and get it checked out. Make sure that there's nothing underlying that needs to be addressed. Then maybe identify different things that might be making it worse. Sometimes maybe trying to cut different things out of your diet and see if that helps. You kind of have to play a little Inspector Gadget to see what is actually maybe the biggest culprit for you. Why does my lower abdomen hurt when I hold a fart? Please don't hold farts. Just let them rip. Get them out of there, because as you hold on to farts, you're increasing the pressure within your intestines, which if you do this for a long period of time, you're actually going to potentially change the structure of your intestines. Most of the time, that gas that you're holding onto is going to be in your large colon. And so if you hold on to it, it actually puts out pooches, like little pockets in that colon, which are called diverticula. And those diverticula could actually then become infected and cause something called diverticulitis. They can even pop open and perforate and cause poop to then leak into your abdomen. So you can have regular infections that cause pain and diarrhea and fevers, or gets even worse than sepsis. Then you could be on a ventilator because you didn't fart. So make sure that you get the farts out of there, okay? Some people produce more farts than others, just depending on what your diet is, the different types of bacteria that are going on. How can you medically make it bigger?
It's not the size of the hammer, it's the nail you're throwing it at!
Typically, a medical reason to have a penis enlargement is usually due to congenital or acquired micropenis. And so the idea is to basically collaborate with a urologist, which is a specialist, as well as a plastic surgeon, to then have a penile enlargement or even transplant. Other things that you can do outside of surgery to make your penis bigger is the simple things of making it appear bigger. So that would be shaving around the area, getting rid of the pubic hair. Then you can also lose weight, so you reduce the amount of adipose tissue around the area, especially in the mons pubis, which is just the area just above the genitals. Why does earwax look like it's whitish yellow, like yellow lemonade or white vanilla liquid? Well, earwax, also called cerumen, is actually quite protective and normal to have in your ear. Sometimes people produce more of it, some people produce less of it, and it's a combination of the oils of your ear.
I thought I told you to wash behind your ears.
Mixed in with the dead cells of the skin of the ear canal. Different liquids that kind of come out of our body have this kind of tinge to it, and it's related to the oils. Depending on the amount of pigmentation within your skin, you may produce more or less oils. So then the color of your oils and the cerumen might be a little bit different. If you guys want me to do a whole video on earwax, what it means to your health, what color it should be, let me know in the comments. Sometimes my kidneys have this feeling like it's bubbling or pulsating randomly for a few seconds or more, but I don't feel any pain or other symptoms from that. What could be happening to cause that? It could be as simple as like a muscle spasm. Could be related to like maybe some dehydration. The good thing about it is that there's no pain, right? But when it comes to kidneys, obviously in your back, right? Usually high up, kind of mid-back. Sometimes we'll see people with pain due to a kidney infection called pyelonephritis. Other times you'll see people with kidney stones. You can also have like blood clots in the vessels going to the kidneys. But typically it could cause pain, but that would potentially cause your blood pressure to go up and your kidney function to significantly start changing and being abnormal. Hey doc, what are the small uniform bumps along the side of my shaft? I'm assuming they're normal, but what do they do? I'm pretty sure you're referring to the glands. They're super small. They're called Fordyce glands, and they're sebaceous glands that run along the head of the penis, the shaft, the labia, pretty much kind of anywhere down in the nether region down there, and they're not to worry. Sometimes they can get inflamed and cause discomfort and maybe get infected, so make sure that they are evaluated by your healthcare provider. There's other things that could happen down there. You can get genital warts that are growths relating to sexually transmitted infections, and typically it's a virus, usually the human papillomavirus, and there's different treatments for that. And then other things it could be is like a friction burn, so you can actually cause a lot of abrasions, so to speak, or a lot of rubbing that could then cause irritation to the skin, cause a little bit of inflammation. Is it true that doctors will place bets to see what patients have before they check? So not really bets, okay? We don't bet. What a doctor does, they listen to somebody's story and they actually come up with their own, what we call a differential diagnosis. So you come up with different things that you think it could be, things that you need to rule out, and like scary different things that you want to think about but are probably unlikely. Could you ask another individual, one of my colleagues, what they think this could be based on the, say, the symptoms? You're just opening up your differential diagnosis. We're not making bets. There's no money, there's no like gain to see who's got the diagnosis, because at the end of the day, especially emergency medicine doctors, we are just there to help you, and so we want to all get to the same end goal of getting the diagnosis and figuring out how we can either make it go away or manage the symptoms. What does it mean if you sweat a lot? I've been to 2 doctors and they don't know why. Maybe you have an answer. It's hard to actually find the why. You're describing something called hyperhidrosis, which is excess sweating. And basically, you're an individual where your body just sweats more for no specific reason, right? The sweating typically could be odorless. Typically, if you have primary hyperhidrosis, this is most likely due to a genetic mutation, meaning like your genes, your DNA. So it's hard to give you, as an individual, an exact answer unless we're actually doing genetic testing. So that's why you may get to a doctor's and they say, hey, we don't have an answer, but there's different ways to potentially help manage this. There's secondary hyperhidrosis, which means that there is a cause for it. Could be a different type of medical diagnosis, say diabetes or Parkinson's. And then you can have medications that causes albuterol, which is like an inhaler, Wellbutrin, Norco, which is a pain medicine. If you are in that boat, sometimes like antiperspirants will be helpful. The idea is to reduce the sweating in the areas that you use that. Why is it when I use the heated seats in my car, it makes me feel like I need to poop?
Look away!
Heat, right? We use heat to cause muscle relaxation, so that could be one of the reasons why. If the heat's turned on, you might be able to relax the pelvic floor muscles. You might generate the heat in that area to cause everything to kind of relax and increase movement. The other thing is it could be related to sitting down. It gives the same sensation that you're sitting down on the toilet to relax everything to get it out. And then when you get into the car, it could be shortly after maybe you had a meal. So then things are moving and, oh, I got in the car maybe an hour after I've eaten and I need to go. So a lot of different reasons why. I think it's more related to correlation versus causation. Maybe that's why bidets are heated as well versus just a cold seat on your buttocks. Because if you have a cold seat, you're probably going to cause muscle contraction, constriction, and not relax. Great questions. Always intriguing, always thought-provoking, keeps me on my toes, but definitely keep them coming, as well as send them to the comment section, to emails, DM. It's all good, every place. If you want your question brought up in a video. Also, check out my new supplement company called Life Happens. And if you like this is the 12th iteration of this. I mean, there's a lot of questions out there. Check out this playlist. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button. Thank you so much for watching, and stay healthy, my friends.